So we have the Southport site and we have the Ormskirk site. They're 7 miles apart, and at the moment we offer different services on different sites. So for quite a few years we've already been having discussions about what we need to do to make sure the services that we're offering at both sites are still fit for the purpose that they were intended several years ago. Now, with COVID coming along this year, all that's done is to highlight to us the need to look at these services and make sure that they are fit for the needs of both Southport and Ormskirk residents that we serve. So we're starting to think about where we currently give our services and what alternatives that we can offer. Because what's the most important thing, even before COVID, is a hospital is part of a community setting. So it's about how we ensure that we can have services that are accessible and not just necessarily coming into hospital to access those services, but how we start to work much more closely with our community colleagues to make sure that people can stay safe and stay well in their own homes. But before we even attempt to go down thinking about how that would reshape, the first thing we have to do, and the most important, is to reach out to the people who actually use our services. So what we want to know is what works really well at the moment, what are people most proud about their local services, and what should we be doing more of. And equally, ideas about how we can build on what we're doing well, because what we want to do is think about these services and how they look in the next 5, 10, 20 years for people that are going to use them. It's not a one-off listening event, it's not a one-off come and tell us what you think, but it's the start of something. So the more people that get involved, the more we can really challenge ourselves to think about how we get services to be the best they can possibly be. There will be plenty of opportunities for people to get involved, and what we're trying to do in a world of COVID where things are a little bit different than they would normally be is make sure there's very different ways to get involved. So to coin the phrase, we really want to get people involved so they really can shape the care together with us.